IUI sample preparation. We have two methods, swim up method and swim down method. Today we are proceeding with swim up method. When the semen sample is adequate in volume, count and motility, we can proceed with swim up method. Materials required: sterile gloves, 6 ml sterile round bottom test tube, 3 ml sterile pasture pipette, slide, cover slip, marker for labeling, compound microscope, sperm wash media, which contains herpes buffer, sodium hyaluronate, HSA, gentamicin and physiological salts. Take 6 ml round bottom test tube. Wear the sterile gloves. Label it with client ID, wife and husband name, residence, date. Mix the semen sample with 3 ml sterile pasture pipette. After complete liquefaction of the semen sample, take 1 drop of the semen sample on glass slide. Now check the semen sample for count and motility under normal compound microscope. This is the pre-wash semen sample. Transfer 2 ml of the liquid semen sample into the labeled 6 ml sterile test tube. Mix equal volume of the sperm wash media with another sterile pasture pipette in 1:1 ratio. Mix the semen sample and the media gently and thoroughly so that it is distributed equally without any air bubbles. Place the mixed semen sample test tube along with the balanced test tube, 8 tightly capped, in centrifuge. At 1500 rpm for 10 minutes. Once the centrifuge is completed, remove the semen sample test tubes. Check for pellet as you see now. Discard the supernatant gently with sterile pasture pipette. we can see the pellet with sperms. To this pellet, add .8 ml of sperm wash media, gently from the sides of the test tube without disturbing the pellet. The loosely capped test tube have to be placed in slanting position . For a period of 30 to 45 minutes at 37 degrees centigrade in a dry incubator. After this time period, remove the test tube from the dry incubator . Check for post-wash of the semen sample under compound microscope. Highly progressive motile sperms. Now this sample is ready for intrauterine insemination. This post-wash semen sample is loaded in an IUI catheter . Gently sample is ready for intrauterine insemination.